we are using the phospholipid layer. So from that lipid layer, it has to cross. So if it is lipid soluble, it is permitted. If it is of low molecular weight, so yes, that would be found because it is like a chota bacha. So it will be allowed to go. That won't be causing much problem. And the third thing is, if it is uncharged, neither positive nor negative, so they are allowed to go. So these are the three conditions. So we'll be requiring something special for other members who are not lipid soluble, who are high molecular weight, who are charged. So in that case, we need to have some mechanism. Say for example, sodium and potassium. See, sodium and potassium, they are charged, right? Charged ions. So we have got that sodium potassium pump which we were talking about, right? See, they are charged, right? So they cannot go by themselves. We need to use some energy. We need to spend something, right, in the form of energy. Similarly, we'll see that when the glucose molecule, classical, which we'll be discussing at length, glucose molecule is a bigger one. So it cannot go by itself. So we have to have a special mechanism. Now that mechanism will be using energy, right? So that will come in when we'll be discussing the ATP needed. So now we focus on the diffusion. Now this diffusion itself, right? It is also not like because there is just one diffusion. So here it is. So think it like we are at this point. Actually, like we are discussing the passive transport. So in passive transport, everywhere, there won't be any utilization of ATP, right? So when this portion would come, I'll let you know that now we are going for that process. Okay. So here it is now, diffusion. Diffusion is once again divided into parts. Yes, just for our reminder, no ATP used. And you will be surprised that this is used at so many places. So we start with what is called as the simple diffusion. Then there is a very fascinating word, interesting word, halt. Simple. Where is it occurring? Let's go to lungs. And from trachea to primary, secondary, tertiary bronchus, bronchioles, right? All those small, and finally we end up in what? We end up in alveoli, right? So this is our alveoli, the smallest function unit of the lungs. And outside over here, so just blood vessel. Okay, here is the capillary. So here is the capillary. And this capillary, we breathe, so the oxygen is over here, right? We are making it big. And over here, there would be carbon dioxide. Because the vessels, they will be getting all the way, they will be coming over here to give the carbon dioxide to take the oxygen. Now, is it so that there is no carbon dioxide in the alveoli? No, there would be small amount of carbon dioxide. There would be small amount of oxygen. Mechanism is now simple. This is a respiratory membrane, right? This is the alveolar membrane. This one, right? This one. It is a single layer, thin membrane. So when the membrane is thin, things are good. All are intelligent, right? This is high concentration of oxygen, right? They go into the blood vessels, and blood vessels happily they carry it, right? Who will be doing it? Hemoglobin, right? Because they have got tremendous affinity. And when we'll be studying hemoglobin in more detail, we'll find that hemoglobin is exactly like you and me, right? There are 4 areas, right? There are 4 areas. When I learned it for the first time, I thought of that this is exactly what we are doing when we were going back to home in the railway train, right? Reservations, because the train timing was at 6:10, right? The departure time. college used to run till 5 o'clock, right? And then you rush to the hostel, you take the bag, right? And then you catch the bus, you reach to the railway station, and then what happens? Over there, it is like you are just 3 or 4 minutes early. Now, whosoever is powerful, right? He'll sabko dhakka maar ke, right? He'll sit and he'll put the hands. Mere dost aa rahe hain, right? And then those 3 seats, no one will be allowed to sit, right? Rumal rakh diya, kitab rakh diya, right? Mere dost aa rahe hain. This is what actually happens. So first oxygen molecule, right? That would be having bit of trouble. But when this thing happens, it facilitates, it immediately makes easy for other molecules to get attached. So first one has to work hard. Other friends, right? They come and all connected, and then they happily take the oxygen for the tissues, and the journey starts. But the whole idea is that oxygen is traveling from high concentration to low concentration, right? From high concentration, it is going towards the low concentration. So it is carried. Now the same thing, reverse is true for the carbon dioxide. Carbon dioxide, that would be released and it will be going. And because this is a membrane, this is a semi-permeable membrane, right? It is a simple membrane. So it will say that no energy is needed. You start exchanging, and this is what is called as the diffusion of gases, right? Something which is occurring in you and me non-stop, every day, every minute, every second. Why is it possible that oxygen and carbon dioxide, they both are so comfortable in this exchange? Two major things. Both of them, they are having low molecular weight. So that serves our purpose, yes. Second, both these gases, they are lipid soluble. So this serves our purpose superbly, right? Both conditions fulfilled. Why to use any of the ATP, right? And things are going good. But when we talk about respiratory system, let's learn some of the pathology. Some pathology. Oxygen is already present in the blood. Oxygen, say it never happens that your blood will be draining its oxygen fully, and it will never happen that alveoli, they will be fully, say, be devoid of carbon dioxide. There is always a gaseous mix, right? Tissues, they can never use 100% of the oxygen. Possible. In this sodium potassium pump won't come. Sodium potassium pump, where is sodium? Where is potassium? And there is no sodium, there is no potassium. We are talking about the gases. We are just talking about the gases. Wait, I would insist, just first understand. Keep the questions. I'll let you know when to ask questions. Right now, just hold the questions. Right, so far this part is not complicated. This is easy. So this is what is called as the diffusion of gases. But when it comes to, this is the normal. When it is a normal thing, it is called as a physiology. I'm telling you, please hold the questions. Right? We'll come to all these things. I'm trying to make things as simple as possible. Yes, I can easily make it complicated by telling you the PPO2 and PPCO2. But what's the point here? When it will come to those partial pressure and partial pressure differences and how to calculate and how these things, they will be affected by the surfactant, we'll see that. Right? I know your knowledge is good, but let's simplify this. Please hold that questions. Once the topic would be completed, nothing would be left out. It is not so that today is the last day of physiology. For next 15 days, we'll be working on everything about the active potentials, what will be happening, all these pumps, various types of pumps, including the medicines, everything. So focus. So now comes those crucial factors which can lead to various disease. Right? So pathology is what? Deviation from the physiology is pathology. Deviation from physiology. It means this oxygen transport is happening, right? Oxygen, whatever we breathe, right? It is going into the blood. Whatever carbon dioxide is into the blood, we are throwing it out. Life is good. But when person becomes breathless, it is like, just for the example, let's say there are 1 million. Yeah, there are much more than that. But just for the example we are talking about, there are 1 million alveoli which are working. What would happen if out of those 1 million alveoli, 30% they are not working? 30% alveoli, if they are not working, then that is a trouble, right? That is a trouble. So we won't be getting sufficient oxygen. If we are not getting sufficient oxygen, what we'll do? Tissues will start crying. Tissues will go on strike. Which tissues will go on strike? Liver would say, see, I am happy. Don't worry about me. I'll manage. Brain would say, no way. Heart would say, no way, right? They'll start crying. In what way? When the heart is not getting enough blood, heart will say, my tissues are dying, so that will lead to pain. Right? First, the anginal pain, in which there is no heart attack. But yes, it is cry of the heart that yes, I can go wrong. Sudarja. In brain, because the brain is complex, blood is going at several areas, but whatever the area which is not getting the sufficient blood, that means sufficient oxygen, that brain, that area would revolt and will send the signals. So it is what we call as the brain stroke when the body is paralyzed, right? Which part is paralyzed? That is what we'll see in neurology. But the brain stroke, when the brain is affected, and the myocardial infarction when the heart is not getting sufficient oxygen. So in both these cases, these two organs, they are extremely sensitive. Right? So this is when the normal physiology is functioning, all is good. When pathology, some variation occurs, the trouble. So why this diffusion of gas should really decrease? See, first thing, this entire diffusion, it depends upon, it is directly proportional. First thing, concentration gradient. Concentration gradient. Concentration gradient means how much is the oxygen available into the alveoli. Now, say if someone is having bronchitis, right? So here is a bronchus, which is a path, right? There is inflammation. So there is inflammation, so there is swelling, and the path is narrow. Have you seen the patient of asthma, right? How do they breathe? Right? That's how they breathe. And then you just in a second you diagnose that this is called as wheezing. Wheezing is because when the pipe is narrowed, so then the air is trying to go through it, right? So it is giving that typical sound, right? Wheezing. But it tells what? It tells that less air is going on the opposite side. Alveoli, they are telling that we are super healthy, we are fine, but the path itself, right? The supply is less. Nothing can be done, right? Oxygen coming is less. It's less oxygen going to the entire body. So if the path is, so there is not enough of the oxygen which is building up over here, right? So concentration gradient is not maintained. It is less oxygen is coming, so less oxygen will be given, right? First thing. Second, when person smokes, right? This is in fact inversely proportional. So I'll just write like this, 1 upon. This is membrane thickness, right? Membrane thickness. There is one condition what is called as the fibrosis. Keeping it simple, this is the normal RBI. And in case of fibrosis, there is fibrosis is over here, right? Over here. So this alveolar membrane, that becomes thicker. That becomes thicker. Right? So now when the membrane becomes thick, so increased thickness, that leads to decreased diffusion. Simple. And this is what we see in case of, it is called as the pulmonary fibrosis. So now person can breathe well, right? No problem. But the respiratory membrane itself is now thickened. When the respiratory membrane is thickened, so now that even if there is enough of the oxygen, there is less oxygen here, but there will be only some who will be able to pass, because now the fence is thicker, the gap is bigger. This is the thick layer which they have to pass, and not every molecule they do it. This is what you see in smoker's lung. Classically, what you see in smoker's lung. Now, when we'll be learning in more detail, or just to give you the idea that what can really happen. See, in our body, there are various types of protein. One of them is trypsin. Right? One of them is trypsin. So what trypsin does is, right, trypsin decreases membrane surface area. Just remember, this trypsin decreases membrane surface area, right? So that we explain the third point. This pulmonary fibrosis, right? You got that smoker's lung, right? Smoker's lung. Chances of emphysema. Yeah, that's right. So smoker's lung, right? This is pulmonary fibrosis. This is with reference to point number 2. The third one is the surface area. Simple, bigger the surface area, more would be the transport. Right? So that's why this is directly proportional to surface area, or we can say membrane surface area. Membrane surface area. Very easy to understand. But see what happens. Over here, we said that there is a substance which is called as trypsin, and that trypsin will shrink the membrane surface. It will decrease it. So we don't want this. So we have to inhibit this. We have to stop it. How will we stop it? There is one more substance, and that is called as the alpha-1 antitrypsin. See the name, so thoughtful, right? Right, alpha-1. So alpha means he's powerful. Antitrypsin, so he's knocking off the trypsin. So that's why membrane surface area is not decreased. But then what happens is that those super smart people, right? Those who feel like that they are very macho man, the smoking. That smoking will knock off alpha-1 antitrypsin. When alpha-1 antitrypsin is knocked off, this trypsin will be released, not inhibited. That will go and straight away it will decrease the membrane surface area. Membrane surface area is decreased. That means what? It is the inefficient lungs. This is what gets done, right? And such things as I don't remember, someone just wrote, right? And you are right. That is what leads to called as the emphysema. Right? Emphysema. Does it increase if someone quits smoking? Yes. But again, the curve is not like this linear. The curve is, it is the logarithmic curve. That means if someone has smoked for 5 years or 3 years or 2 years, whatever the amount of duration for which someone has smoked, coming back to original lung efficiency, it takes almost double the time. Right? It takes double the time. Trypsin is present at several locations. Right? It is at several locations, and every time there is a different mechanism. So this is what happens, and this is what is called as the emphysema. Now, inefficient lungs, then heart would say, that brain would say, do hell with if we are getting less oxygen, tissues are demanding oxygen. So heart, beat fast. So there would be tachycardia. Heart rate would increase, right? For no reason, there would be increased heart rate. So that means that someone who is even sitting, but because he is a heavy smoker, right? If he is a heavy smoker, so then what happens? Heart rate increases even at rest. So their resting heart rate will be high. So what happens when they really try to struggle, when they really try to exercise? Right? Their efficiency is decreased and they won't be able to run even for a short distance. Immediately they'll be gasping. So do remember that this is how things they get attacked, right? So we saw that concentration gradient, it is the membrane thickness and the membrane surface area. These are the three things. Still more to come. Now this is pretty easy to understand. The solubility. If we have the substance which is soluble, that is the lipid soluble, right? Lipid soluble. So it is directly proportional. More the solubility, more it will go, right? And the fifth thing is, it is inversely proportional to the molecular weight. So smaller one with the small molecular weight, they will go faster. One with the bigger molecular weight, they'll go slower. Right? So this is but obvious. But these two things, they are of extreme importance. Right? Crystal clear? Now we move to the next part. Now, so this was the simple diffusion. Fourth point is solubility. We talked about that. Solubility. If anything which is lipid soluble, anything which is lipid soluble, which is low molecular weight and which is uncharged, they will be able to pass through easily. So more the lipid solubility, it passes. Okay. So till this point, things were good. But that's not true. Right? True for our all, like say sodium, potassium, because they are charged, calcium, right? They all are charged. So they won't be allowed this easily, right? Very important, glucose. Size of the glucose is like a dinosaur, right? He is a big molecule. So he will not be allowed easily, right? There has to be a special mechanism. So in order to see this thing, there is, let's draw. Once again, this is like our cell. Right? For sodium, potassium, calcium, right? For sodium, potassium, we know this, that there was sodium, potassium pump, right? But still there will be more things. But meantime, first, let's understand for the glucose. Because if you understand for glucose, it has to be very easy, extremely easy. Now, insulin is needed, right, for the glucose control, that you know. So what insulin will be? Say insulin, it comes into picture. It comes into picture when it tells that it will stimulate, right, and it will lead to that glucose release. Right? So then that glucose will start. In short, this is the cell membrane, and insulin is again a big molecule. It cannot enter into the cell. So not possible. So it can't go. So there is a mechanism. There is a mechanism where it tells that all we need to do is when the insulin comes over here, so there would be inside effect. So basically these are what? These are receptors, right? We talked about that these are receptors. So this is a receptor where the ligand is insulin. So when that insulin lands over here, it will be, I'm using the word autophosphorylated. There is autophosphorylation. And last time we talked about that phosphorylation means activated, right? So in simple words, if we write, it is activated. The inside is activated. Inside is activated. Now, what insulin does? Let's say you eat something, right? You eat gulab jamun, right? Blood is loaded with glucose. Now, function of insulin is take that glucose, right? Pakad ke sabko, right? To put them into the liver cells, right? So that more sugar should not be circulating into the blood. Otherwise, sugar is the world's best culture media, right? And it will lead to infection and this, that, and so many things. So for that, glucose has to enter into the cell. Glucose will say, I am also a monster, right? I also can't. Insulin say, I can't. Then let me call someone, right? So insulin will make a call. So this is the receptor where the message will go inside. So inside portion, this portion will be now active. When it will be activated, so then, sometimes when there is landline, so we just say, phone aaya. Same thing happens over here. Inside the cell, there are small vacuoles. These are small vacuoles. Well, they all are swimming at ease. And all these vacuoles, they are having some tubes with them. They are holding tubes. So message comes to them. Right? Insulin has called up. So everyone is okay, chalo. Right? So they will all start traveling towards the surface. And on surface, they'll open up. Right? So now the new situation would be like this, right? They will just embed their tubes, right, onto the cell membrane. Now these are the gateways. Which are meant for our glucose, right? So these are the welcome gates, and the glucose starts coming in. Right? Glucose enters. Where was the glucose moved? Inside or outside? Outside, right? Because cell to bichara aise, cell has got no glucose, right? So outside, thanks to that gulab jamun, right? There is glucose everywhere, right? Glucose, so much of glucose. So this means this is high concentration. And in cell, there was a low concentration of glucose. So again, nothing. It is simply from high concentration to low concentration. No energy is used. Only one thing, that because of this receptor, these vesicles, right, they just created those paths, and they are called as the GLUT. These are called as the GLUT, GL, glucose transporter. Right? They are called as the glucose transporter. So these glucose transporters, they were already present, but now they are moving they have been lodged into the cell wall, and through that gracefully, all these glucose is coming from high concentration to low concentration. When we say that high concentration, right, high concentration to low concentration, this means there is no energy utilized. And when it is going from high to low, This is called as its diffusion. It's diffusion. But this diffusion is not simple. This diffusion was, say, thanks to this insulin receptors, right? These receptors, they were responsible, right? They initiated the whole process. So that's why someone helped, someone facilitated. So that's why this is called as the facilitated diffusion. Facilitated diffusion. So again, you are not using any energy in it, but definitely it is getting help. Our glucose is getting helped by someone. So that's what we are supposed to write. Simple diffusion and facilitated diffusion, right? That is also diffusion because diffusion means high concentration to low concentration, right? So that was the idea, right? This is what is called as the facilitated diffusion. So far clear? Any query, any doubt? So that we go to the next level. Because this next level is going to fascinate you. You'll be so happy. No, energy receptors are like ligand gated. When the ligand comes, they are activated. Right? So simple as that. So making it fast. This is ligand. Ligand means any of the chemicals. So in this case, it is insulin. Insulin comes, receptor is activated. It is activated. It would stimulate. Right? It would stimulate these GLUT. GLUTs are glucose transporters. These are the all inside. These are the supply of those tubes which are inside the cell. They will go on the surface on the permission of this insulin, and the process starts. The glucose starts transferring from high concentration to low concentration. Right? It will start transferring from high concentration to low concentration. That is done. Right? This is because it is going from high to low, and that's why we are calling it as a facilitated diffusion. Now, still in more detail. When we say facilitated, right? Basically it is facilitated transfer. Facilitated transfer. So in this, we use something, and that something was this GLUT. So what is this GLUT? It is a protein. It is a type of protein. So that is what is called as the carrier protein. It is carrying this carrier protein. So there is always a carrier protein, right? So this is for glucose. This is for glucose. Similarly, it would be for water, right? When the water would be going. So for water, there would be special channel, and that is called as the aquaporine. Right? Aquaporine. So for water, it is just a simple channel. But over here, for our glucose, it is fantastic. And yes, this is a question which will be asked in quite a detail. So when for glucose, we said there is glucose transporter. Glucose transporter. And that's why we said it GLUT, glucose transporter. Now there are 5 types of glucose transporters, 5 types, and you need to know all these 5 types very properly. So here it is we'll be understanding all 5 types, all the 5 types, but we'll understand it in such a way that after 10 minutes, for rest of your life, you will never forget any of the type of the GLUT. Right? Just, no, today I'm not recording. So, because those who are over here, those who are coming and learning, so this is like a respect to all of you. Those who are not attending, this is not the way. Right? When I get some of the emails that just for a trivial reason, they don't attend. So don't worry about it, just focus here. So these are the 5 types of glutes. 5 types. You need to know all these 5 types of glute with precision. So now you'll be drawing it along with me. Right? Take a piece of paper, and what I say, just you have to write 5 words. Bas, that's it, and you will always remember. So here we start with glute 1, right? Glute 1. Glute 1. Sorry, I don't remember that what was, there were so many emails. But anyway, by the end of the session, I'll open things for the discussion. Right? So whatever your query is, we will discuss. Coming back to this, glute 1. For 1, write it like this. 1 independent. I know spelling of independent is INDEPENDENT. Right? Just hold on for 30 seconds. So coming back to this, independent, so we write it like this, I. Right? So this is independent. Think from that perspective, that which are the areas, irrespective, whatever the body is having, right? They say we need glucose, right? Whatever happens to others. And the first candidate is brain. Right? Brain will always take majority of the glucose, and simply because its glute receptors, they are like type 1. So type 1 would say we don't care for the rest of the body. Whatever the level, even if it is low, they'll just grab it and they'll use it. Right? That would not be the case for other type of receptors. They'll be sensitive to the levels. Right? So if the level drops, their efficiency drops. Not in case of 1, they are independent. Second, the placenta. Placenta, baby is considered as very selfish, right? Whatever happens to mother, right? The baby should get the glucose. So placenta has got the type 1 receptor. Immediately pick up and will take. Right? Our RBCs, red blood cell, they'll say that we need glucose, because if they'll stop working, then what would happen? And then don't forget one very typical, and that is the cornea. Cornea, 5. So these are like independent. Say brain, plasma, and the RBC. That is easy. Usually people miss this, so that's why I'm just putting a tick on this. Whenever you revise, keep an eye on cornea. So this is type 1. Type 1 means they are independent. Clear? So not depending upon the glucose concentration. They just absorb. On to the second one. And this is glute 2. Right? So when we say alpha means what? 1. Beta means 2. You know, beta means 2. So here is, where do we find these? We will find it at all the points wherever the number 2 is there. Right? So we'll be highlighting this 2. How? First, beta cells, right? Islet of Langerhans. Right? Beta cells, islet of Langerhans. And they are into pancreas. Right? Now see, these are, they release what? They release insulin. And these are nothing but these are the glucose sensors. Right? These are the glucose sensors. So they, over there, these glute 2 is sitting. And these islet of Langerhans, beta cells, they are nothing but glucose sensor. Right? So how much glucose will be entering? Whatsoever the glucose which is passing through that glute 2. So GLUT2, through GLUT2, right, it will come into pancreas, and pancreas would say such high insulin, such high glucose, insulin go, and then insulin will be released into the system, right? So that's why these beta cells, they are the glucose sensors. But how do we remember that GLUT2? Beta means 2, correct? What are the other areas? Other areas are 2 organs, 2 kidneys, 2 kidneys. So that's why these GLUT2 sensors, they are into kidneys also, right? Liver, 2 lobes of liver, right and left. So that's the beta cells, 2 kidneys, 2 lobes of liver. So that is where the GLUT2 receptors would be there. And now you draw one figure around it. This is what? This is stomach, right? After stomach, there is duodenum, right? And then jejunum, right? Duodenum, jejunum, ileum. But we'll be drawing it like this. I think you got my point. This is the visually, so that you always remember it. Visual. Intestines. Right? Intestines. So GLUT2 type of receptors, they are found in beta cells, 2 kidneys, liver, and intestine. Then you don't have to remember it, speak like in Viva, that 2 kidneys. Right? You can confidently say beta cells, kidneys, liver, and intestine. But in the back of your mind, it would run like 2 kidneys, 2 lobes of liver, and the image. Right? This is 2, that's intestine. So these are the areas where GLUT2 receptors will be there. So let me take you slightly into medicine. You love it. This is GLUT2. I'm keeping the chat on because now I want that you should really answer. Now the question is, what if this GLUT2 goes wrong? Something goes wrong. Right? This GLUT2, it goes into mutation. Now you know mutation means it won't function. Right? It won't function. This leads to what's called as the glycogen storage disease. Right? When the GLUT2 mutation occurs, right, it is called as the glycogen storage disease. Now it makes total sense, complete sense, right? Because these say insulin came right to the liver, right, and it is stimulating, and it is telling ki chalo, let's fill. But this is like this GLUT2 is not functioning at all. It is not functioning. So in such cases, this will lead to what? There would be increase, there will be glucose intolerance. Yeah. So there would be now see, in case of mutation, that means everything would be affected. Right? Everything would be affected. How everything? Yeah, that's right. You are writing is true. How the things will be going? There would be first increase liver size. Liver size would increase. So that is what is called as the hepatomegaly. Hepatomegaly. Then GLUT2 is affected, so kidneys are affected, right? So there would be kidneys would fail, so that would be nephropathy. That would be nephropathy. And this glucose, right, they won't be able to store it. Right? They won't be able to store it because this GLUT2 is not functioning. So whenever it is needed, that glucose, it will be released outside because here is the liver cell, right? Here is the liver cell. So these these transporters, right, they are for in and out. So now when the liver is having enough of the glucose, but it is not released, right? So this is like a glycogen storage disease. It will keep on storing it, right? And that leads to so many complications. That means the growth would be less, there would be dehydration, there would be fatigue, right? Collectively, when the mutation occurs, this is called as the Fanconi syndrome. It's called as the Fanconi syndrome. So at this point, right, we are not going into the much details of, because it will be affecting almost every level, right? It will be affecting brain, it will be affecting the kidneys, it will affect the neural system. Right? Nephropathy means the kidneys will start failing, kidney failure. Right? But here, what I'm trying to emphasize is that if GLUT2 is affected, then what would happen? That would happen that kidneys would be affected, liver would be affected, right? Intestines would be affected. Yes, because they are present at that point. They are over there only. Imagine beta cells, right? Islet of Langerhans. So they were doing what? These beta cells, they were like a glucose sensor, but they will sense the glucose when? They will sense the glucose only when the glucose enters into them. What if this glucose is not entering into the cell? So then islet of Langerhans, they are aram se baithe. When the glucose will rise, will release the insulin. Till that point, aram karo. So even if the glucose level is shooting, right, they are not releasing any insulin. So that leads to kidneys. Kidneys, they will be overloaded, so much of glucose, so that will start developing widespread infection. So that will lead to nephropathy. So all these organs, wherever the GLUT2 are there, that would be affected. So that is what is called as the Fanconi-Bickel syndrome. And this is Fanconi-Bickel syndrome. Even if you remember just Fanconi syndrome, then also it is fine, right? But the idea is GLUT2, right? That is affected. On to the GLUT3, right? On to the GLUT3. When you say 3, you speak tree. GLUT3 is GLUT3. Tree is, must have seen a neuron. So if we really become slightly more creative, and we say, can we say like that? This is like a tree. That's where it is used. Neuron. So for rest of the body system, yes, exactly. Rest of the body system, wherever the neurons are there, it is GLUT3 which is utilized. So see how typical the thing is, that when we'll be using certain drugs and we say that yes, this should affect only GLUT3, then yes, makes a difference. When we say no, we want that only GLUT2 inhibitors, so yes, they will be affecting only on those two, that means liver and kidneys, right? They will be primarily affected. So that's how it goes. So this is the GLUT3, right? Very easy to understand, that will be taking care of the neurons, right? Whenever the neurons will be requiring, so they'll be picking up the GLUT3. Comes GLUT4. But we'll write 4 like this, right? I know we can easily write like this, no, but we want to write it like this. We want to write 4 like this. This 4. And over here, we write insulin, right? And how do we write it? We write it like in small INSU LIN. This is how we write. This will give the visual impression. suppression. So this is insulin dependent. Insulin dependent. So these GLUT4, they are the actual ones who are responsible for type 2 diabetes. What really happens in adults, type 1, which happens in newborns. So this is the insulin dependent. That means this is the adipose tissue, like fat cells, adipose tissue, then the heart, skeletal muscles. This thing will give you the idea that why the exercise is so important. Yes, it is mellitus, right? Diabetes mellitus. So adipose tissue, skeletal muscle, heart, why they are so important, why it is so important to do the exercise, right? When we'll be discussing diabetes in detail, we'll mostly be focusing on this thing. Right? This is the GLUT2, adipose tissue and skeletal muscles. That is whenever the skeletal muscles they have to utilize, they will be activating, they'll be calling GLUT4. Right? So see how precisely the whole thing is good. Now comes the fifth one, and that is the GLUT5. It is the GLUT5. Instead of 5, I have written 5 like this. 5 for fructose. 5 for fructose. 5 for fertility. So in case of seminiferous tubules, in testis, so the fine movement of the sperms, once again, fine movement of sperms, that is what is by GLUT5. Right? Same thing, it would also occur in GIT for the proper peristaltic movement. Right? Is this GLUT5. So these are the 5 different type of tubes, right? Glucose transporters. So what we do now is we just stop at this point. Next time we'll be continuing from here onwards, right? From here onwards, because from here the next is the active transporter. So I'll be uploading this file, but next time I'll write from this point on. GIT is gastrointestinal tract. GIT. So next time we'll start from active transport. Now in active transport we know one part, that is the primary active transport, sodium potassium pump. Then we'll be going into the secondary active transport, and in secondary active transport we'll be talking about various drugs which will be acting at various levels. Right? That is where we'll get the answer of that canagliflozin or epagliflozin, all those medicines, how they really act and why they are so expensive. Right? So you will be able to understand it that yes, they are expensive for the activity. For the transport of protein, it is what is called as the aquaporine. Right? There is a specific water molecule tunnel. It is the tunnel for the water molecule. This is the aquaporine. So that is only for the passage of water. So it goes via that. Because water is not lipid soluble. And water is not lipid soluble. So when the water is not lipid soluble, so how will it pass? So for that, the tubes are put. And water, you go via these tubes. Right? Because otherwise, so it is all lipid soluble. So that's why special tubes for it. GLUT5. So GLUT5 is for fructose metabolism. In males, in testis, there are seminiferous tubules, right? They are highly coiled tubules, and that is where the sperms are produced. And these sperms, right, they are responsible for the fertility, and the sperm, there is a wiggling, right? So they should move very finely. So this movement is handled because, and for that movement, they require glucose. They require glucose, and that's where the GLUT5 will come. That is where they will be getting that they will be having GLUT5 receptors, so that glucose can really enter into it and then give the energy so that they can go for the fine movement, right? With or with so that is what is. So that is GLUT5. So this is GLUT1, GLUT2, GLUT3, GLUT4, and 5. One is independent. 2 is for all those dual beta, 2 kidney, 2 lobes of liver and intestine. GLUT3, that is for the tree, that is neuron. 4 is the insulin dependent, very important. Right? This would play a very major role in many of the conditions, especially when we'll be discussing about diabetes and the energy and the exercise physiology. Right? They will be very much important. As some question was asked that I do go to gym regularly, but still I am very thin, very weak. So, gentlemen, that can be because of one important thing. I have replied to your email also that your protein intake is less. So, doing only the active exercise, that is not enough. You go for good exercise, but then give the time to rest. Give your body a time to rest, because it is during the resting phase when actually the muscles would recover. And then, so muscles, they break. So this is called as the micro injury. And during the rest time, they make themselves. So when they make themselves, they are much stronger than the previous one. But in order to say this repair, protein is needed, right? Protein is very much needed. So doesn't matter even if you are veg, pure veg, right? Not even eggs. Though people do take eggs, right? They are good, but we do have, say, proteins like whey protein, and then you can have lots of sprouts. Sprouts, they are good. Oats, they are very good. So many things. Don't mix two things, right? When you are learning, let's say anatomy, I'm telling you, don't say watch the video, download the PDF, and then revise this PDF only. Don't worry much about it, that I go into the books also. Don't do that. Don't do that. Whey protein, say, depending upon your budget, the best is gold standard from Optimum Nutrition. Right? I'm not advertising it, but this is the gold standard. It is considered as the best because it is used by the Olympics people. Right? Say, and it is really good. You feel the difference. And say that is by ON. It is called as ON, Optimum Nutrition. Ideal thing is, say, you should consume at least, you should consume at least, if you are a male, and let's consider that your weight is about 65 to 70 kilograms. It is this much. So then 1 gram per kilogram of body weight. Now this is true for male as well as female. But in case of female, if her weight is, say, 50 kilograms, then she has to do it accordingly. Now this is for someone who is not doing much of the exercise. But if you are hitting the gym with power, right, or you are going for weightlifting, and yesterday I was talking to my USMLE students. I was teaching osteoporosis. Osteoporosis, when the bones, they become thin. The best what you can do for the bones is do a power training. Right? In power training, it is the combination of strength and the endurance. strength and endurance. You lift weight, you do boxing, right? You go for sprint, high speed. In such cases, when you are utilizing this energy, so your bone metabolism that much better. Not only the muscle, but even the bones. So it is at that point when you have to increase this dose to 1.2 grams per kilogram. Right? There you have to increase the protein consumption by 20%. Now, one scoop of the whey protein that consists of about 25 grams of absolutely pure protein. One scoop should be enough. But in case if you feel like that by the end of the day you are absolutely exhausted and you feel that power, so then you can add at night. That's why I said that it would be bit costly. But in a long run, if you find that yes, it would save you from so many diseases. But anyway, coming back to this, you can have paneer. Paneer is very good. You can have sprouts. You can have peanuts. Not those salted, etc. Right? Don't take salted peanuts. Why to put unnecessary sodium to the body? Not good. Simple plain peanuts. Yeah, you can just air fry it or just warm it in the micro. They'll be more crispy and you enjoy eating it. But nothing else to be added. Second scoop is to be added, and if you are adding it post sunset, then whey protein, it is not, because whey protein consists of some amount of carbs, and those carbs, they can really shoot your glucose level at night when it is not. So in such case, you might have to go for what is called as the isolate component. That is called as the whey isolate. Whey isolate means this is with zero carbs, zero carbohydrates. And when the carbs are zero, that will improve your efficiency next morning to very high level. So many brands are available. So just look at it that in case of whey isolate, someone is not fooling you by just telling you this is whey isolate. You need to go for, just check the ingredients. It has to be absolutely zero carbs. Peanut butter, definitely, right? It is, I take it every day. But peanut butter is fantastic. Peanuts, peanut butter, because it will be having zero carb. All right. So I'll upload this file right now. And what we do is, next time we'll be starting from this point onwards. Which PDF are you talking about? So if you're talking about the PDF of those videos, right? So in the description, there is a link which is given. When you click on link, straight away you will be landing at the site where all the PDFs are. So all the PDFs are at one location. So single shot, you can download all the PDFs and done. Then keep on watching the video and the PDFs are with you. Your choice means today one by one or all together. Regarding this particular file, you must be having the link. If the link is not there, just send a mail to me. All right. I missed that. I'll upload that music. My mistake. I'll send it. So thank you so much, and we meet very soon. Thanks a lot. To revise. Okay. Now I'll upload this. Now I'll upload this file. Okay. Thank you. Bye-bye. Same to you.